How you doing? It's Dr. Bone at New Jersey Regenerative Institute. So welcome back for part two with our discussion and interview with Dr. Ron Dellanno, the CEO of Cervigard. If you missed part one, definitely go back. You'll get a big introduction to the thing we're talking about called forward head posture or text neck, as well as the origins of Cervigard. And that's something we're going to talk about with another example today and a little bit more information. So welcome back, Ron. Thanks for coming back and talking to us.
It's my pleasure, Dr. Bowen, and I look forward to our part two.
Okay, so last time we talked about a younger gentleman who was a musician, a case, and how he pretty much didn't have a lot of degeneration in his neck and did well. And we're going to get into a second case in a minute, but people are going to say, well, what's the proof that this Cervigard thing actually works, other than what you said in part one, is that hey, everybody's doing better and it's a cure. Do you have information about more where people are really interested in, like, I don't want to put this thing on, it might hurt me.
So it doesn't hurt. We did a preliminary. Our first study was done between Kessler Institute, Kessler Foundation, Dr. Gerald Malanga, and myself, and we had a combination of patients from his hospital and from his clinic and from our clinic in Bloomfield, New Jersey. So we had 17 subjects, all different ages, and the results were just absolutely off the charts. And one of the reasons why the following study, which was done at the Walter Reed Military Hospital in Bethesda, along with USU University, the Department of Defense issued a budget of $250,000 to do trials on 40 soldiers. Those trials have recently been completed. I think we have one more soldier at this moment, but the data has been looked at, and it syncs with the data we got from the first study at Kessler Hospital, along with, I believe, your institute for rehabilitation. So we have two studies now that have shown its efficacy. There's no downside to this. There's no people with negative impacts. There are some exemptions that we've come up with over the last few years. People have had spinal surgery where they have fusion with hardware on the rear of their neck, posterior hardware. They are not candidates for this. People who have tumors in the vertebrae or bone infections in the area of the cervical spine are not candidates for this technology. All right. All the rest of the folks can benefit. And today, this part two, we're going to show you a case who had no way to get well on their current methods that exist today to treat patients, yet the Cervigard was able to turn it around. So it'd be good for us to spend a few minutes on this case because I'll outline the symptoms. It's a 70-plus-year-old female with advanced degenerative joint disease in the neck. She's so debilitated, has difficulty walking, difficulty turning her head side to side. She has pain shooting down her arm into her hands and fingertips, and the pain was excruciating. Now, this is the patient wearing the Cervigard. She also has a scoliotic spine, so we treat her scoliosis in her lumbar spine as well. But there she is, side picture. You see the Cervigard on, the cheek pads just below her glasses. They're lining up. You can't see her ear there, but if we could pull her hair back, her ear is right about there where your hand is, lined up over the shoulder, doing its job. And when we look at her x-rays, I'll go into a few details. Let's look at the x-ray on the left. This is the standing posture of the patient. Now, the yellow curved line in the front of her neck, that's your normal curve line. That's where all the tips of the vertebra should be up against that line. Any measurable distance off the line causes tremendous pain into the neck area, resulting in arthritis. Now, this woman has had this neck for over 30 years, and there's a lot of consequences to see here. So let's show the patients the C4 and C5 area, Dr. Bowen. And you notice that that's right where the hand is. There you go. You see the fusion. There's no space between either of the vertebra. That means it's fused. And if you look at the vertebra above the fusion, the number 3 vertebra, it looks like it's falling off a cliff. It's in our medical description, we say it's a flexion injury of C3 over C4. But right at that point, there's a tremendous kink in the spinal cord, giving this woman a severe pain in the neck, headaches, and pain radiating down into her arms, on the right side into her hands and fingertips. Now, we put the collar on. If you look at her spacing on the C3 to C4, we've measured that out. Yes, you can see it now. It's at 3.75. But let's look at the original one, Dr. Bone. What was that distance? It's at
It looks
13.
like 13.9.
All right, so it's over a half inch, 13.9. We put the Cervigard collar on, and let's look at the one on the right. That same measurement is down to 3.75. So that's a tremendous difference. And why is that happening? Well, if you look right behind her neck, there's a fulcrum. It looks like a spring with a pad and an arrow. That's pushing her neck forward. Now, for the doctors out there, this is impossible to see this x-ray without this technology. And as a result of this, we were able to reduce the retrolisthesis of C4. And notice that C3 is no longer hanging over the edge of C4 in a flexion position. Also notice the inferior aspect of the body of C2. It's now in a slightly upward trajectory, whereas if you drew a line along the base of the body of C2, see that, Dr. Bowen? Yeah, it's going upward trajectory. So it's looking upward in the curve. If you look at the original one, it's actually going a downward trajectory. So the head is in flexion, the jaw is way down. Right. And that measurement's good too. 17 millimeters in that one. On the one with the collar on, it's down to 7. So we improved 10 millimeters on that one. Actually, pretty much in both of them. 10 millimeters. That's just shy of a half inch. That's a lot of correction in there. So she had this on for, it didn't change much the first few days. I think it took her about 2 weeks, but all the pain in her neck was diminished, maybe 80, 90%. The pain down her arm was gone. The numbness in her fingertips was gone. And we consider that a successful case. Now, I didn't do a whole lot of manipulation or adjustment in that neck because it is so severely damaged, but we were able to defer to the Cervigard. So it was passive in a sense that you adjusted it around the patient and you just gave it time, 20 minutes a day, and she had a very good result. So patients out there, if you're older, 60, 70, 80, and you've had this chronic neck pain, you now have a tool in this Cervigard collar, forward head posture correction collar, to reduce the strain in your neck and get you some relief. Now, it's not going to fix your injuries, but it'll stabilize it and give you a high quality of life. And I think that's a good exchange.
Yeah, I mean, once you have some damage you can't really reverse the clock, and that's why it's so important with these young kids. And their first example from part 1, where we want to prevent this degeneration. I mean, we're all going to degenerate and get older. The question is how well we do it. And I'd rather have a neck that looks like this when I'm 105 than when I'm 60.
Well said.
Yeah.
And that's to have a tool that can manage it.
Yeah. And then at least, you have less pain, better quality of life. And that's what we all want, I think, is better quality of life.
Sure.
So can you give us a little insight as a CEO of what's new to come? What are the other thoughts is going to happen? More research, more changes to the collar?
Well, what we're going to do, we've made some changes in the collar. They're subtle things, but they're very powerful. I don't know if this audience would appreciate it, but you would if we got down to talking about it. It's about the fulcrum in the back. We now bifurcate it so that there's room for the spinous the pressure not to be directly in the spinous process, but it feeds into the lateral aspects of that in the lamina. We spread the force over a greater area. People with herniated discs and spurs can tolerate the pressure behind the neck a lot better. So it's more for the more aged population or the patients with more severe damage, particularly whiplash injuries. So you could be 25 years old, you were in a car accident, you had a bad whiplash injury with a disc problem in your neck. This bifurcated fulcrum will allow some relief and give broad support for the neck and have a more smooth correction with no discomfort.
And research-wise, any new things coming in the research?
Yeah. We're thinking about actually we're applying for an expanded grant for the Air Force. I don't want to get too far ahead of us because our colleagues at Kessler Foundation are going to be writing up this grant. I think you might be involved, Dr. Bowen. So that's going to be we want to fit all of the helicopter pilots and all the jet pilots and also for those in the naval aspect of our small watercraft that go at high speeds over the water. These poor folks, these soldiers are getting terrible whiplash. These are our special forces soldiers. So this will be a nice intermediary to relieve the strain from the chronic whiplash of hitting over those waves at high speeds. So the applications now are spreading not just from the average public who looks down at electronic devices, but all the other areas in life where action is taking place, particularly in the military. So the Air Force and in that particular area of the Navy are going to be targeted for the next large study. We hope to be several thousand soldiers. That way we can get a nice database that from this point, it should just be issued as standard issue for all military soldiers, especially infantry, because like kids carrying backpacks on their back for school, soldiers carry backpacks that are 5 times that weight, 150 pounds or more. And so the only way they can move is to lean forward, project their head forward, kind of like they're climbing up a hill, in order to counter the heavy sack on their back. Sometimes it includes a rifle, ammunition, water bags, and other equipment, not to mention the ceramic bulletproof vests, which can weigh up to 60 pounds by themselves. So,
All the technology, the batteries, yeah, they're
yeah,
getting weighted down with so much technology.
exactly. In fact, we have one of those soldiers was Special Forces. He was a Green Beret. He gave his testimony on our website, cervigard.com, Sergeant Major Mike McGarvey. Might want to check out his testimonial and how he's been helped with the Cervigard and what he had to do while he served in Afghanistan and Iraq.
We appreciate their service so much, and hopefully this is a
Sure.
little something we can do for them. So
Yeah, it was
I
a
know
good
the
story.
military, yeah, the
Yep.
military has definitely put some priorities on these things for our soldiers to try to figure out how they can help with knee arthritis, with newer treatments like we're doing and other things. So hopefully we can help our soldiers as we learn the technology. And it's
Yeah, and
not,
then beyond that, we would like to get the word out to various educational facilities and to the public at large through mediums like this, where it can be used as a consideration when they start seeing these children, 9, 10, 11 years old complaining about neck pain. They should immediately know it's because of forward head posture, and at least to be a technology at the ready where a nurse could prescribe it or get it to the child to relieve the initial pain. It might even be something that over many hours of time, the workforce can consider using that for people who have to stay at a desk for 8, 10 hours at a time.
yeah, and people probably don't know. It's just like one of the things is one of the greatest disabilities in the United States is car accidents. This
Yeah.
whiplash that people have, even after they're quote done with their case, they have a lot of chronic pains and whatnot after the fact. So another great technology to add to it. So it's been a great discussion. Again, if anybody missed part one, there's a little more detail. Go back, take a look at that. Anything else you want to add to the conversation that we may have missed or overlooked?
I would just like to say that be on the alert, especially for the lay public. When you start feeling something's not right in your neck, your shoulders, your back, this could also relate to back pain. If your head's forward all the time, it can actually have an effect all the way down the back. If you have these symptoms in the early stages when you're young, they're not dramatically painful, but they will get that way over time. Be alert to that and take action. Explain it to your parents. If you're a teenager, you're older, bring it to the attention of the doctors that you trust, your chiropractor, your physiatrist, your physical therapist, and make your symptom known to them so that some action can be taken. And now that you know about this, I wouldn't be surprised if the doctor or therapist you bring this to would not have heard about the Cervigard yet. But then you could take a look at this YouTube with them or send it to them, and then they could learn for themselves. So don't be quiet about the pain. If you attack it early at the first beginning stages, there's usually no damage left to your neck. You fix the problem and you're done with it.
Yeah, the old adage just rings true, right? Is a ounce of prevention is worth a pound of cure.
Certainly true. Yes.
So again, I want to thank Dr. Dellanno for being with us and getting interviewed. If you haven't seen our other interviews, take a look at the YouTube channel. Just a little preview of what's to come. We'll be talking with Mr. DeRose, who's the CEO of the Kessler Foundation and the research that they're supporting and their goals and mission. And as the future comes, people may have heard we're going to have hyperbaric oxygen in our office in February of 2025. So we're also going to talk to the CEO of MD Hyperbarics, Chris Neal, who we're working with and collaborating. So again, hit that like button, hit that subscribe, thumbs up, hit the bell notification so you know what's happening, and it doesn't cost you anything. Helps us a lot, and hopefully this information is really valuable to you, and you can share it with other people. Don't
Bye-bye.
forget our socials. So X, formerly Twitter, Instagram, Facebook, all that jazz. You guys know what to do. Thanks. Have a good day. And Ron, thank you so much for what you've done for our soldiers, the technology for our kids, and what we can do with helping people as they get older.
Thank you very much. Pleasure.
All right. Have a great day.
Bye-bye.